Good morning, everyone. What a fitting location to have a significant announcement on a beautiful day here today in Charlottetown at the University of Prince Edward Island. My name is Greg Naterer. I am the Vice President Academic and Research here at P.E.I, and it's a pleasure to welcome you. I would like to begin by acknowledging that we live, study, work, and learn here on the traditional and unceded territory of the Mi'kmaq people known as Ebikwit. It's an absolute pleasure to welcome you here to UPEI's Faculty of Medicine and Interprofessional Health Facility, a state-of-the-art facility that spans approximately 140,000 square feet with an investment of $91 million that's been made, of which $30 million has been for technology. We understand it to be the most technologically advanced medical school facility in Canada. The province and university came together with a bold vision, making this project possible through funding from the Government of Canada, the provincial government of P.E.I, and UPEI donors. We greatly appreciate their support, and we're not bashful in saying we welcome more. So, just a few words. I'll keep my remarks brief. This facility is uniquely designed for the Faculty of Medicine for medical learners, but will also accommodate students from the Doctor of Psychology program, nursing, paramedicine, kinesiology, and veterinary medicine. It will also create a hub for interprofessional and interdisciplinary learning. The facility will also be home to a provincial collaborative care center called a patient medical home with a capacity for 10,000 primary care patients. All in all, we are extremely proud of this facility, what it will accomplish, and the state-of-the-art education that it will provide to students. At this point, it's a pleasure for me to welcome the Honourable Sean Casey, who is Liberal candidate and member of Parliament in the Charlottetown riding.
Thank you very much, Dr. Naterer. I'd like to recognize some of the platform guests here. My fellow candidates, Heath MacDonald, Kent MacDonald, and Bobby Morrissey are here with me. I'd also like to recognize the Dean of the Med School, Dr. Preston Smith, and the COO, Paul Young, who would proudly tell you that this project is on time and on budget. Pour moi, c'est vraiment un honneur d'être ici parmi vous aujourd'hui pour présenter le Premier ministre du Canada, mais aussi de vous accueillir ici, à la berceau de la Confédération. Et même chose pour le Premier ministre. C'est vraiment ici un bâtiment auquel nous sommes tellement fiers. C'était une vision, comme vous avez entendu, qui a duré quelques années, qui est maintenant une réalité et qui représente vraiment l'espoir pour l'avenir ici à l'île de Prince-Édouard du point de vue d'accès des médecins ici. Et c'est grâce à un investissement du gouvernement fédéral de 19,5 millions de dollars. The UPEI Medical School represents hope. In the short term, it has proven to be a tool for recruitment of family physicians to come here who want to teach a course, but also spend time on Prince Edward Island. And we do expect that will provide some relief in terms of the problem of access to primary care here. In the midterm, you heard about the patient medical home. 10,000 patients. Just to put it in perspective, the patient registry in Prince Edward Island is about 37,000. 10,000 are going to have access to primary care when the patient medical home is up and running. And in the long term, homegrown Prince Edward Island doctors to help address this critical need. Friends, we are in turbulent times. Donald Trump has disrupted world economics and threatened our sovereignty. This is my 5th federal election, and never before have I seen the engagement so high. And I know it's not unique to Charlottetown. This is borne out by the numbers that have voted in advance polls and at returning offices across the country in this election. Over the last several weeks, it's become clear to me, and I expect to all of the other candidates, that voters want reassurance, stability, and an adult in the room, someone with the depth, the temperament, and the experience to guide us through this, to meet the moment. That person is undoubtedly Mark Carney. And for me, with the polarization, with the rise of misinformation, with the U.S.-style personal attacks making their way into our daily political discourse, it is absolutely remarkable that public life can still attract someone of the caliber of Mark Carney. So thank you, Diana, and thank you, Prime Minister. And with that, I present to you the pride of Fort Smith, Northwest Territories, the leader of the Liberal Party of Canada and the Prime Minister of Canada, the Right Honourable Mark Carney.
Good morning. Good morning, everyone. Bonjour tout le monde. Thank you very much, Sean. Thank you, Heath, Bobby, Kent. Great slate of colleagues here. Thank you, Greg. I'm going to use you as the representative of this amazing facility. 29 months from shovels in the ground to being ready on time, third week of August for 20 Islander medical students. Phenomenal achievement and an exemplar for the rest of the country. And I'm going to go into more detail about healthcare in a moment. But first, I want to speak of someone who just passed and who deeply and profoundly touched the lives of billions. Pope Francis was a voice of moral clarity, spiritual courage, and boundless compassion. He was, in many respects, the world's conscience, never hesitating to challenge the powerful on behalf of the vulnerable. Aujourd'hui, le monde a perdu un homme qui a profondément touché la vie de milliards de personnes. Le pape François était la voix de la clarté morale, du courage spirituel et de la compassion sans limite. Il était la conscience du monde et il n'hésitait jamais à défier les plus forts au nom des plus vulnérables. Above all, His Holiness understood and taught that value in the market must never eclipse the values of society. He wrote about the cry of the earth and the cry of the poor, reminding us that ecological degradation and social injustice are deeply entwined. During his papal visit to Canada in 2022, his apology on residential schools was a crucial step in moving the Church forward in its journey towards meaningful reconciliation. And one parable he shared in about a decade ago has consistently guided my thinking. He compared humanity to wine, rich, diverse, full of spirit, and the market to grappa, distilled, intense, and at times disconnected. And he called on us to reintegrate human values into our economic lives. Valeurs humaines, compassion, solidarité et durabilité dans nos vies économiques. He reminded us that markets don't have values, people do. And it's our responsibility to close the gap, to turn that grappa into wine. So I join others in reflecting on his pathing and commit myself to fulfilling his challenge. Je me joins à tous qui reflètent son décès et je m'engage à perpétuer son héritage et surtout à relever son défi. So, as I said, I'm pleased to be joined by an exceptional group of candidates: Bobby Morrissey, Heath MacDonald, Kent MacDonald, no relation, not that I know. Is that right? Is that right? Yes. And Sean Casey. And again, thank you, Dr. Naterer and the P.E.I. Faculty of Medicine for hosting us today. It is a tremendous privilege to get an early look at this new medical school, state-of-the-art medical school. And I would like to thank, again, all of those who've helped to fund it, to help to conceive it, to build it, and bring life to it. These are people who are dedicating their lives to healthcare, healthcare research, healthcare education, helping to make communities here on P.E.I. live better and healthier lives for longer. You are building Canada strong as we face the biggest crisis of our lifetimes. President Trump has been attacking Canada, America's closest ally, America's closest partner. Il menace nos entreprises, il menace nos travailleurs, il menace les placements de nos retraités. He's trying to break us so that America can own us. And that will never happen. But as he fundamentally tries to restructure the international trading system, he is rupturing the global economy, as Sean just said. And the 80-year period when the U.S. embraced the mantle of global economic leadership, when it forged alliances rooted in trust and mutual respect, when it championed the free and open exchange of goods and services, that period is over. And our old relationship with the U.S., based on steadily deepening integration, is also over. And that's a tragedy, but it's also our new reality. We are responding with purpose and force. We're fighting these unjustified tariffs with counter tariffs of our own that will cause maximum damage in the United States with minimum impact here in Canada. We're protecting our workers and our businesses, using every single dollar from those counter tariffs. And above all, we're building Canada strong. Nous devons comprendre ce que nous pouvons et devons changer. Nous sommes maîtres chez nous. Nous pouvons contrôler notre destin économique. We can and will control our economic destiny with the right plan. Because in a crisis, plan beats no plan. And to succeed in a crisis, you must act with overwhelming force, to overcome anxieties, to break through the fog of uncertainty, and to replace what the crisis is taking away. You see, as the private sector retreats in a crisis, government needs to step up, to provide direction, to drive action, to catalyze investment. And that's what our plan to build Canada strong will do. Now, as in so many things, healthcare is at the core. In the U.S., healthcare is a big business. In Canada, it is a right. It is a right that my government will fight for and invest in. Notre système de santé est ancré dans nos valeurs. Ça fait partie de notre façon d'être. Nous avons raison d'en être fiers, mais nous devons aussi reconnaître qu'il peut et doit être amélioré. Et ce que nous sommes en train de faire, entre autres, avec le régime canadien de soins dentaires et le programme d'assurance médicaments que nous mettons en place. Dental care and pharmacare are strengthening our public health system. And my government will ensure that dental care will be available to more than 8 million Canadians, saving families an average of $870 a year per person. P.E.I. would cancel it. Pharmacare will provide free contraceptives to 9 million Canadians and diabetes medication to almost 4 million Canadians. Pierre Poilievre will eliminate it because he thinks it's everyone for themselves. We know these programs are making a real difference in the lives of Canadians. We know that we're all in this together. And we know that we also must do more to build a stronger healthcare system that's there for Canadians when they need it. That's why part of our plan to build Canada strong, at the core, we have a strategy to protecting universal public health care while making the system work better. And that strategy has 5 pillars. First, we're creating more spaces for patients, by building more hospitals, clinics, and other practice spaces. We know that hospitals and clinics have been closing when the needs in the healthcare system are growing. We have to reverse this trend and increase access to team-based care. That's why we will commit $4 billion to work with provinces, territories, and Indigenous communities to build more hospitals and clinics and to renovate community healthcare infrastructure. The second pillar is to help to add thousands of new doctors to our healthcare system. The most pressing need in our healthcare system is for healthcare professionals. Right now, more than 6.5 million Canadians don't have access to a family doctor or nurse practitioner. We'll help tackle this shortage by working with the provinces and territories to create more spaces in medical schools like this one and more residency positions so trained doctors can gain experience. We'll also help doctors with the costs of opening a community practice, whether it's the space itself or the medical equipment that they need. And we'll work with the provinces to make sure that our healthcare professionals can work anywhere in Canada as part of a drive for free trade in Canada by Canada Day. We'll do more to streamline credential recognition and attract global talent, including physicians and researchers who are based in the United States. So to the Canadian healthcare professionals practicing in the U.S., let me say this. If you've been thinking about coming back to Canada, there's never been a better time to come home. Our third pillar is to modernize our health system. To make sure it operates more efficiently for the benefit of everyone, we will take measures to ease the bureaucratic load that are on our healthcare professionals. Nous voulons que les médecins, infirmiers et infirmières puissent dédier plus de temps à leurs patients et moins de temps à la paperasse. C'est pourquoi nous allons moderniser notre système de santé en tirant profit de nouvelles technologies et en investissant dans l'innovation. Nous faisons en sorte que votre médecin et vous puissiez consulter votre dossier médical, peu importe où vous vous trouvez au pays. Et quand de nouveaux médicaments sont développés, nous allons les rendre accessibles aux Canadiens et Canadiennes 2 fois plus vite. Fourth, we're investing in women's health and protecting reproductive rights. But for a flight problem, we were to be joined by Dr. Josh Reimer, the president of the Canadian Medical Association, one of the world's experts in specializing in medical and maternal care. And as Dr. Reimer can attest, our health care system has been too slow to understand and care for the unique needs of women. My government will invest to address this inequity. And most notably, when it comes to the health of new mothers. Nous prenons aussi des mesures pour s'attaquer à la violence envers les femmes, notamment à travers le plan que j'ai annoncé cette semaine pour renforcer le contrôle des armes à feu. Mais ce n'est pas tout. Nous allons augmenter nos investissements dans le plan d'action national pour mettre fin à la violence fondée sur le sexe, guidés par des experts pour s'attaquer à ce flux. Nous allons protéger le droit des femmes de choisir. Au Canada, l'avortement est un droit. Le débat devrait être clos. Nous allons protéger la santé et les droits des femmes en rendant permanent le financement du Fonds pour la santé sexuelle et reproductive et créer un nouveau programme qui va fournir jusqu'à $20 000 pour couvrir les frais d'un cycle de traitement de fécondation in vitro. We will protect these rights by always standing and defending the Charter of Rights and Freedoms. Pierre Poilievre is now committing to override your constitutional rights. As I warned in the leaders' debate, the Charter exists to protect people, especially the vulnerable, from politicians. And once they start overriding your rights, when will they stop? Fifth, we're improving support for mental health and substance abuse. Canadians know that we're facing a mental health and substance abuse epidemic that's causing immense suffering for Canadians, especially younger Canadians. Most of us know someone who's struggling or who has had struggles with mental health and substance abuse. Many others struggle in silence without the support of friends and family. They deserve help, not hardship. They deserve support, not stigmatization. They deserve solutions, not slogans. Nous allions investir pour offrir des soins de santé mentale à 100 000 jeunes Canadiens et Canadiennes de plus chaque année, avec un nouveau fonds pour la santé mentale des jeunes qui sera doté d'un financement permanent. Nous allons soutenir les communautés autochtones et les organisations communautaires dans leur lutte contre les dépendances et la crise des surdoses. Nous allons rendre permanent le financement de 988, la ligne d'aide en cas de crise de suicide, qui en un an a déjà répondu à plus de 300 000 appels et textos. Overcoming mental health and substance abuse challenges is one of the hardest things for a person to do, and it's even harder when you don't have a safe space to call home. And that's why we're investing deeply in affordable housing, supportive housing, and shelters through Build Canada Homes, the new housing organization I announced a few weeks ago that uses Canadian technology, Canadian skilled labor, Canadian lumber. Under our new government, our public health care system will be stronger because we will build up the institutions that make Canada, Canada. We won't tear them down. This moment calls for us to build and to build on our values. Now, as far as I can see, the Conservatives don't have a health strategy, unless you can call cuts in times of crisis a strategy. And the Conservative leader doesn't have a plan to stand up to President Trump, unless you call surrender a plan. Perhaps they believe that the way to defend ourselves is to leave every Canadian to fend for themselves. Perhaps they believe that we should go along to get along with the Americans, that the best way to get through a crisis is to keep our heads down, to give the Americans what they want and hope for the best. That's not what will make Canada strong. I know, we know. We know we have everything we need in this country to make the best country in the world even better for everyone. The choice in this election couldn't be clearer. In this crisis, do we want to meekly accept what the Americans want, or do we want to stand up for ourselves and for each other? Do we want to cut what we need, or do we want to invest in our future? I know we can give each other far more than the Americans can ever take away. And I know as America retreats from the world, Canada will lead it. Our plan is to fight back against President Trump's trade war, while boldly and ambitiously investing in Canada, including by reinforcing our public health system, a system that embodies the Canadian values of solidarity, tolerance, and kindness. We will make Canada strong. Thank you. Merci.
We'll now begin the question period. We'll do 5 minutes of local question. 15 minutes de questions à la délégation, ensuite les médias locaux. Première question, first question, Ashley.
Good morning, Mr.
Morning.
Ashley Brooks, CBC News. Do you think that Pope Francis's apology for residential schools in Canada went far enough?
I think, as I said, Ms. Burke, the apology was an important step in the Church's journey along reconciliation. It was a historic step, but it is a journey along reconciliation. And the Church, and dare I say, all of us have more to travel on that journey. And certainly my government is committed to advancing reconciliation if we are returned. Thank you. Certainement, ce que le pape a dit est une étape importante dans le processus de réconciliation pour l'Église, mais il y a plus à faire pour l'Église et pour nous tous, et notre gouvernement sera dédié d'avancer le processus de réconciliation.
What else do you think that the Pope could have done or said to advance reconciliation? And as well, do you think the Catholic Church should become more progressive, and if so, on what issues?
I sometimes say I'm not a jurist when matters of before the Supreme Court. I'm not a theologian. What I am is a politician, and what I'm conscious of is what the government can do, what we can do as a country to advance reconciliation. The first is integrating it to all aspects of what we do. That means working with First Nations. As you, well, I'm going to repeat, but in my first week as Prime Minister, I made the express point of going to Nunavut, meeting with the Premier, meeting with Indigenous leaders, as well as meeting with all the heads of the Indigenous organizations within the first week, ensuring that they're integrated into this bold plan to build Canada, not just in words, but in process and in decisions, and then very importantly, providing the financial resources so that they can be true partners. And I'm speaking specifically around the Indigenous Loan Guarantee Fund, the $10 billion, which provides a mechanism so that they can have ownership in these nation-building projects that really are necessary for us to build Canada strong. So I focus on what we can do, how we can move forward, and making sure that, as I say, that that's integrated. And I'll note as well and commend Dr. Young and Dr. Smith and Dr. Naterer and the whole staff here that integrated into the medical training here are reserved places for First Nations students. Sur le pape, je suis responsable pour les actions de le gouvernement et je suis dédié à avancer le processus de la réconciliation. C'est les raisons pour lesquelles j'ai rencontré les dirigeants des peuples autochtones pendant ma première semaine étant Premier ministre et que nous avons créé un processus un processus avec eux et nous et les provinces dans ce processus d'identifier les projets de l'intérêt national et de fournir le financement pour des partenariats avec les peuples autochtones dans ces projets-ci. Madame.
Bonjour, M. Carney.
Bonjour.
Leader Mark Carney, la presse. Vous venez d'accuser M. Poilievre de vouloir utiliser la clause non-obstant pour s'attaquer au droit à l'avortement. Mais M. Poilievre a explicitement dit qu'il ne le ferait pas. Donc, pourquoi cette accusation?
Oui, c'est une accusation, mais ce n'est pas une accusation, c'est un fait. C'est un fait. Il veut ignorer la Constitution de notre pays, des droits et libertés de tous les Canadiens et Canadiennes. Il veut ignorer, supprimer une décision du Cour suprême. Et j'ai dit, OK, on commence là et on finit où? Ça, c'est la question. Ça, il y a une raison pour laquelle c'est le job, à mon avis, c'est le job du Premier ministre et du gouvernement fédéral de défendre le charte des droits et libertés. I said that Mr. Poilievre has decided to ignore our Constitution, to override our Constitution, to ignore and override a decision of the Supreme Court. And the question is where you start, isn't where you start, but where do you finish once you start doing that? It is the responsibility, in my opinion, of the Prime Minister of Canada, of the federal government, to defend the fundamental rights of Canadians and the Charter of Rights and Freedoms, not to override it.
Mais ce qui est un fait aussi, c'est que M. Poilievre a affirmé qu'il ne le ferait pas. Donc, juste peut-être faire la distinction là-dessus. Mais la question de suivi, c'était sur les positions de vos candidats, de vos députés. Vous savez que M. Trudeau n'acceptait pas au sein de la députation des députés qui étaient en faveur de l'avortement. Quelle est votre position là-dessus?
Je suis convaincu que c'est leur responsabilité, comme je viens de dire. C'est plus négociable. Il y a un droit fondamental de l'avortement ici au Canada. C'est le job du Premier ministre de défendre le charte. Et c'est tout. Hein.
Oui, mais est-ce que des candidats...
Je ne suis pas, OK.
Est-ce que des candidats contre l'avortement peuvent être au sein de votre parti, peuvent se présenter?
Il n'y en a pas. D'accord.
Good morning, Bill Curry from the Globe and Mail. Your platform talks about Buy Canada measures in government procurement as a response to U.S. tariff threats and actions. The Globe reported this morning that on the issue of cloud computing and data storage, the government is planning to lock in for 25 years an arrangement with several U.S. multinationals on that. And that this has raised some concerns from other companies, and this is expressed in government documents. Do you share that concern, and are you planning any action to kind of reduce the federal government's reliance on these large U.S. tech giants to just deliver government services here in Canada?
Yeah, it's an interesting. Thank you for the question. Look, my government will undertake a comprehensive review of government procurement, for several reasons. First and foremost, value for money and the effectiveness of that. Secondly, and I won't go into all the details, I spent a day on it, on defense procurement and being more effective and having a bigger impact domestically in Canada, being more rapid given the rising security needs, but also with respect to your question in terms of having maximum economic impact, buying Canadian where possible, or having a strategy that develops an ability to buy Canadian. So we have it in defense as we're building out with Europe on Rearm Europe. Again, a bigger discussion we should have. I don't think there's been enough focus on the progress we've made there. But with respect to technology, we have many strengths in this area, including in artificial intelligence, intelligence infrastructure, data infrastructure. And the question is, how do we strategically develop this as a country? How do we go from where we are today, which is too high dependence on U.S. providers, to a more balanced approach, greater diversification, including greater domestically. So you've asked a very fundamental strategic question. I share the strategic objectives of that, and it is an important element of our economic strategy.
And then a question about your platform and the bottom line. So under Jean Chrétien and Paul Martin, the Liberal Party took a lot of pride in focusing on balancing the budget, and when we balance keeping it there. I think a lot of people were kind of hoping that your leadership would mark a return to that focus for the party. That doesn't seem to be the case in the platform. There's no reference to ever balancing the budget. and you are suggesting you will walk away from the fiscal anchor that the government stated just as recently as December, which was to keep the deficit below 1% of GDP. So what do you say to Liberals and Canadians who are disappointed to see that direction?
Well, this is a fundamentally different approach. This is an entirely new government. It's a fundamentally different approach. Okay, first thing. It is an approach that does two things. First, it gets government spending under control. So if you go back to the previous government, this spending was growing at 9%. We're going to grow spending over the course of the next 2 years, or 4 years, sorry, at 2%. 9%, 2%. Huge shift in terms of control on spending, bearing down on spending, getting that operating spending balanced over the course of the next 3 years. The second element that's different, fundamentally different, that meets the moment, is that we are in a crisis. We are in a crisis, the worst crisis of our lifetimes, including the fiscal crisis that Mr. Chrétien and Mr. Martin faced, because we are in a fundamental reordering of our relationship with the United States and the global economy. We need to build, we need to invest. We need to use scarce dollars on the federal balance sheet to catalyze that investment. And we're prepared to do that, we know how to do that, and we're moving forward. We have a very prudent approach to our cost reductions, okay? I fully expect that we are going to exceed those cost reductions, but we have a prudent approach to it. And if I shift over, we have a detailed plan, fully costed, lays out this approach of spending less, investing more. Pierre Poilievre doesn't have a plan yet. He's hiding it. He has $140 billion of cuts that he needs to produce. He's already identified that he will cut dental care. He will cut child care. When I say cut, eliminate. He'll cut the CBC. He'll cut foreign aid. We'll see what else he's going to cut in order to deliver that. Cutting to the core of institutions, cutting to the vulnerable, cutting to all Canadians at any time, let alone in a crisis, is not the way you get out of a crisis. It's not the right approach. So there's a very clear, choice that is here. One meets the moment, which is ours. And the other, well, given that that was his approach to COVID, that was his approach when he was 17 and writing his essay about when he wanted to be Prime Minister, that's his approach for any moment.
Bonjour, Monsieur Carney.
Bonjour.
We'll just do last question to the delegation before going to media. Dernière question à la délégation. Yes.
Michel Sabat, la presse canadienne. Monsieur Carney, craignez-vous que les Canadiens acceptent l'argument du Bloc et du NPD de revenir voter pour eux maintenant qu'il semble que votre parti formera le prochain gouvernement? Et aussi, pourquoi avez-vous donné votre numéro à Monsieur Blanchet et cherchez-vous déjà un partenaire?
Parce qu'il m'a demandé, je suis un gentilhomme, ok. Il m'a demandé, ok, pas de problème. C'est amusant. Alors, en ce qui concerne, nous sommes dans une crise. La crise la plus grave de nos vies. Il y aura, dans quelques jours, il y aura une négociation avec les Américains. Il faut avoir un gouvernement avec un mandat fort, un mandat clair. Il faut avoir un gouvernement avec un plan pour le moment, avec un plan qui fait face à cette crise, avec un plan qui nous rendons mettre chez nous. Et c'est notre plan. I gave him my number because I'm a nice guy. He asked for it, I gave it to him. If you ask, I'll give you my number if you ask for it. Okay, yeah, let's throw it around. I know, I shouldn't have said that, but whatever, that's fine. Look, Doug Ford gives his number out. He's got 4,700 texts, that's what you get. But anyways, hopefully I won't get 4,700 textos from Monsieur Blanchet. But no, seriously, I gave him a number. I wouldn't take a lot of signal of that. We're in the most serious crisis of our lifetimes, and we need a government that has a strong mandate, a clear mandate. We need a government that has a plan that meets the moment. within a few days, the Prime Minister of Canada will be sitting down with the President of the United States. It's a choice. Do you go with a plan? Do you go with someone who knows how to negotiate? Do you go with someone who knows how to manage a crisis? Do we send someone who has the backing of the Canadian people? That's the choice in the election. Thank you.
Il y a un avis sur le carbone qui sera versé cette semaine aux Canadiens de toutes les provinces, sauf aux résidents du Québec et de la Colombie-Britannique. Or, le rabais, c'est une avance sur des sommes qu'Ottawa collecte par la suite. Pourquoi donc priver les Québécois et les Britanno-Colombiens de votre cadeau électoral?
C'est pas correct. Il y a un rabais, mais nous avons fait, depuis longtemps, j'ai fait un engagement aux Canadiens et Canadiens que avec la supprimation de la taxe sur carbone des consommateurs, hors de Québec, hors de la Colombie-Britannique, nous allons rendre entier les gens. OK? Qu'est-ce que ça dit? Non, arrête, attendez. Il y a une taxe, il y a un rabais, et pour la plupart des Canadiens et Canadiens, le rabais, le net est positif. Okay? Avec la réduction de la taxe et la supprimation du rabais, il faut avoir une réduction de la taxe sur la classe moyenne. Mais il y a une période de 3, 4, 5 mois entre le dernier rabais et la réduction de la taxe de la classe moyenne. Et on a tous les chiffres. Je peux vous fournir tous les chiffres. Alors, c'est une méthode d'équité pour des gens. OK? Et c'est évident que les concitoyens du Québec et de la Colombie-Britannique ne paient pas la taxe sur le carbone consommateur. Alors, c'est pour le reste du Canada, en effet. Mais on va vous fournir les chiffres. Monsieur.
Local questions.
Morning, Mr. Carney.
Morning.
Stu Neatley from Guardian. So your platform includes a commitment to reduce both Confederation Bridge tolls and Wood Island's Caribou Ferry tolls. However, one of the main demands from Eastern P.E.I. has been for a reliable two-ferry system. Our reporting has found that there are not yearly inspections conducted by Transport Canada on the ferry. Instead, they rely on marine classification societies for these yearly inspections. So, as Prime Minister, would you commit to yearly Transport Canada inspections of the vessels that it owns?
Okay, well, I will give, I'll give you, always dangerous, off the top of my head response, which is it seems sensible to me, so I will commit to looking into that and providing a direct answer on it. I think certainly the safety of passengers is paramount. But I just want to underscore what we're doing. Reducing the toll on the Confederation Bridge to $20, cutting the cost on the ferries, and maintaining the ferries. To be absolutely clear, Pierre Poilievre, it's not clear he's maintaining the ferries. We're more than cutting the cost on the ferries in half, so that islanders have the options, and ensuring that the same is the case for commercial transport. So these are important savings. Ensures that the system continues to run. That's why we maintain some element for maintenance, but we want to make sure that maintenance is done properly. So I take your question in the spirit it's given. Thank you.
We'll do a last question. Dernière question.
Est-ce que vous pouvez dire la même chose en français, s'il vous plaît?
C'est la dernière question en français.
Il
faut choisir. Il faut choisir.
Okay, non. En anglais, alors.
Yeah.
I know you're in the medical school. You outlined a number of initiatives for improving the healthcare system. I think a lot of Canadians, a lot of Islanders have heard multiple announcements about how it's going to get better. Can you say when access to healthcare, when do you expect it to get significantly better?
Well, it's the fundamental question. Canadians deserve a much better system than they have, and this is true. It's true on the island. It's true across this country. There's more than 6 million Canadians who don't have access to either a doctor or a nurse practitioner, for example. And those who do have access, I think we all know that access can sometimes take too long. Look, we know where the competence lies, where the responsibility lies with the provinces first and foremost. Where the federal government can help is in the types of initiatives we're announcing today. Big scale investment in bricks and mortar and capacity that drives increases in physicians that will serve out careers on the island and across Canada. Big financing for those who are graduating so that they can start their practices, including community care practices. So the scale of this model, this is significant, what we're doing. Is it going to be the last word on healthcare financing? Absolutely not. I wouldn't ever stand with a mission accomplished banner behind me on that. But it's the type of model that accelerates world-class healthcare provision on the island and beyond. Thank you.
En français? Sur le traversier, le pont, est-ce qu'on peut avoir...
OK, mon gouvernement va couper en deux les prix pour les ferries et les conserver, préserver, retenir. Pas comme M. Poilievre, c'est pas clair du tout. Il se peut qu'il annule les ferries ici. Et nous avons réduit, nous allons réduire les coûts pour le pont à $20. C'est une grande réduction ici. Alors, ça suffit, hein?
Mais je pense que sur les inspections.
Sur la sécurité, ouais, c'est une question c'est une question d'inspection. J'ai dit, OK, je vais réfléchir sur cela. C'est pas plus complexe que ça. OK.
Merci. Thank you.
Alors, merci. Merci beaucoup. OK.